In today's video, we are talking about a step-by-step plan for the first 6 weeks after childbirth. Welcome back to my channel, and if you're new here, hi, I'm Shriti. I'm a board-certified physical therapist helping postpartum moms just like you regain strength and confidence in as little as 15 minutes a day so you can spend more time enjoying with your little one without worrying about aches and pains. So let's dive into today's video. For the first 2 weeks after childbirth, I want you to follow this rule 5-5-5. What this means is for the first 5 days after childbirth, you are focused on staying in the bed. For the next 5 days, you have to focus on staying by the bed. And for the next 5 days, you have to be near the bed. So you're in the bed, by the bed, and near the bed. So now let's understand what it means. So for the first 5 days, staying in the bed means you are prioritizing rest. Rest, rest, and rest. You are not allowed to get out of the bed. You cannot go to the kitchen, start doing the chores. No matter how much normal you feel, the focus here is to take rest as much as possible. During the first 5 days, you really need to ask for help. This could be from family members, friends, or anybody you feel comfortable around. Have them come over and help you with the baby and take care of yourself. Now, for the next 5 days, which is from day 6 to day 10, you have to be by the bed, which means that you are allowed to get out of the bed from the laying position and you can do some movement, but you're still focusing on rest. This could mean that you could take a short walk to the bathroom and back, or maybe you could help a little bit with the baby, but for most part, you are still focusing on resting. You're not allowed to go to the kitchen, you're not allowed to walk around the house. You're still near your bed, which means you're by the bed. We are not walking or doing any form of physical activities. All you can do is sit up edge of the bed, maybe walk to the bathroom and come back, but still focus on resting. For the next 5 days, which is from day 11 to day 15, this is more about staying near the bed. So now we're at a point where you can stand up and walk to the kitchen, get some water and come back. Maybe take a small walk around your house and come back. But here the goal is still resting and staying near the bed. So we're still not at a point where we can start taking outside walks or start exercising, maybe go for a grocery run. Focus on resting still. No matter how much normal you feel and you feel like you are back to your pre-pregnancy state and you can start taking over more tasks, the focus should be resting. So for the first 15 days or 2 weeks, our main focus is just resting. It is important to ask for help. It is okay for your family members, your friends to come over and let you help. Because here is the key. You have to slow down to speed up. If you start thinking everything is fine and I can just start bouncing back, that's not true. Your body needs rest and time to heal. So for the first 15 days, prioritize resting and staying near the bed. In no form you want to start going outside, strolling with the baby, taking walks, going to the mailbox, checking the mail. No. We have to stay near the bed and rest for the first 14 days or 15 days. So that's why it is 5, 5, and 5. So first 5 days you're in the bed. For the next 5 days you are by the bed. And then for the last 5 days you are near the bed. Now once we have passed the first 2 weeks or 15 days, then we can start doing a little more activity. So let's see what that looks like now. So now coming to week 3. At this point, you can get outside your bedroom, come out to the living area, walk around a little more. In week 3, I really want you to focus on deep breathing exercises and some outdoor walking. So when I say deep breathing exercises, what we are really trying to do is taking deep breaths into your core muscles and slowly breathing out. We're really trying to focus and expand the belly and the rib cage area. So when you take deep breaths, it's not you're taking everything up, but you're expanding everything. What this does is it really helps relax your core muscles and the pelvic floor muscles. During the third trimester leading up to the delivery date, there is a lot of tension and tightness that would start building up in that pelvic floor area and in the low back muscles. As the belly starts growing, all the muscles would start compensating and creating a lot of stress in those muscles. So the first thing you want to do after delivery is deep core breathing. This really helps relax your core muscles and the pelvic floor muscles, and is a really good starting point before we get to any type of exercises. Now, in addition to the core breathing exercises, you can start taking 5-minute short walks. This can be within your home, or you can step outside and get some fresh air. But still be mindful that rest is important. So we do not want to go for 30-40 minute walks yet. The focus is 5 minutes of walking and deep breathing exercises. So maybe you can even do the deep breathing exercises 3 times a day. So do it for 5 minutes in the morning, 5 minutes in the afternoon, 5 minutes in the evening. I understand that during this time, you might have the urge of scrolling on social media, watching television, which is fine, but start focusing more on prioritizing your health and healing in a way that would help you get back to your pre-pregnancy health faster, but in a sustainable way. So going back to the pre-pregnancy state doesn't mean that you can start going to the grocery stores or start lifting heavy weights, start working out in the gym. We still have to be slow and careful on how we move the body and be very intentional in what you're doing. So week 3 is all about deep breathing exercises and 5 minutes of walking either inside your home or outside. Now, as we move on to week 4, we are building this up based on week 3. So we will still continue with your breathing exercises, 5 minutes of walking, but now we will add some gentle stretches. This could be gentle neck rolls, up, down, sideways, or maybe some passive stretches to release the tension. But again, I do not want you to lay down your yoga mat and start doing this full-on yoga session. We're not there yet. During week 4, I still want you to focus on deep breathing exercises in seated position, walk for 5 minutes, and add some gentle stretches, preferably in the sitting position. I do not want you to start straining your body so suddenly. So still stretched out so you can relax those muscles, but try to do it in a seated position where there is not a lot of changing positions or movements happening. We want to have a very slow transition so that we are not risking any injuries or having any aches or pains. We want to be really mindful and careful of how we progress. So week 3 was just your breathing exercises and walking. Now in week 4, we are adding some gentle stretches, preferably in seated position. Next, moving on to week 5. Building this up upon week 4, we will progress our walking from 5 minutes to about 7 to 10 minutes. Again, you might feel stronger and you might feel motivated to go ahead and do a 30-minute walk, but please resist that urge. Do not go beyond 10 minutes of walking in week 5. This is because maybe one day you feel great and you will go ahead and do the 30-minute walk, but it is going to set you back for next few days. Your body needs to build up the endurance and stamina real slow, and be careful and gentle with your body. Do not push yourself too hard. This is the time where you have to prioritize rest, and after rest, you can add on these activities. So 5 minutes of breathing, 10 minutes of walking, and some gentle stretches. At this point, we can start doing some stretches either on the floor or continue doing it seated. Be mindful and listen to your body. If something feels uncomfortable, please stop and consult your healthcare provider. Do not push through pain. I know you are really strong mamas, but this is not the time to push through pain. I want you to listen to your body and see how it feels. Do not think that, oh, this is fine and I can push through this. During the first 6 weeks, we have to be really careful on how we are treating the body. Do not force yourself to, oh, I can do this. Oh, I did this before pregnancy. It is fine. Things do change and we have to be careful and be easy on ourselves. We cannot force ourselves, oh, if I did this before pregnancy, I should be able to do this. No, there is nothing that you should be able to do. Everything starts again, and be gentle on what you do and how you do. So let's recap week 5. Continue with your core breathing exercises. You can do 10 minutes of walking and stretches either on the floor or seated, whatever feels comfortable. But again, when it comes to stretches, we're limiting it to 5 to 7 minutes. So I do not want you to go ahead and pick a random YouTube video and start doing a 30-minute yoga session. No, that's not the goal in week 5. We are still prioritizing rest and gentle movements to improve your muscle flexibility and increase the blood circulation through them. So gentle stretches that would help relax the muscles and improve the blood circulation is the goal here. And lastly, coming to week 6. During this time, I still want you to continue with your deep breathing exercises. You can move on to about 15 minutes of walking. However, if 10 minutes is enough, stick to 10 minutes. You do not have to increase. This is just in case if you feel that 10 minutes was too easy and you want to do more, you can go up to 15 minutes of walking. And now in week 6, I do want you to start with gentle core activation exercises. Since you have been stretching for a couple of weeks now, we have warmed up the body enough to start with some gentle core strengthening exercises, which really means focusing on those six-pack muscles that usually get separated during pregnancy. We're trying to activate those muscles and bridge the gap back, trying to heal your diastasis recti. So let's recap what is our plan for the first 6 weeks after the baby is born. For the first 5 days, we're staying in the bed. We are resting. We're asking for help from our family, friends, whoever you feel comfortable with being around you, but ask for help. Have them come over and help you with the baby and with you. Maybe have them cook meals for you. Whatever is easier for you, but ask for help so you can stay in the bed and rest for the first 5 days. For the next 5 days, you have to be by the bed. So it is okay to walk to the bathroom and come back, maybe sit up for a little bit if that feels good, but you're still by the bed. We're not leaving the bedroom yet. For the next 5 days, we have to be near the bed. So now is the time when we can go out to the kitchen or the living room, grab yourself a glass of coffee and come back, drink some water, go to the kitchen, come back. But again, you have to be near the bed. So we're not leaving the home yet. We can leave the bedroom and go around the house, but we have to be near the bed. Next, coming on to week 3. This is when we can start adding some core breathing exercises and 5 minutes of walking, which can be inside or outside based on how you are feeling. Again, these are just guidelines. This is not a set in stone program. So listen to your body, get consultation with your healthcare provider, make sure that what you are doing or you want to do is okay. Every pregnancy is different, every mom's body is different. So it is important that you ask your healthcare provider on, this is what I'm planning to do. Is it okay? Next, moving on to week 4. We're still doing our deep breathing exercises. We're still walking 5 minutes, but we can add some gentle stretches in seating position. In week 5, we're still doing the breathing. We can now walk up to 10 minutes. So between the 7 to 10 minutes walking is okay in week 5. And we can start doing some stretches on the floor or continue seated, whatever feels good. And coming to week 6, continue with your breathing exercises. You can walk up to 15 minutes. You don't have to, but you can if you want to. And add some gentle core activation exercises. So this was a step-by-step plan for the first 6 weeks after the baby is born. I really hope this helped you understand what are the things you can do, but more importantly, what you cannot do. So the good news is you can start moving and exercising before your 6-week checkup with the OBGYN. So that's good that you don't have to stay and sit all the time, but you also have to be mindful on what you are doing and how you are doing. It is really important to progress gradually and don't just start off doing something where your body was not trained or was not ready for it. I hope this video helped you. If it did, make sure to hit the subscribe button below so you can stay updated with daily tips and resources I would share on this channel so you can have a faster postpartum recovery. I'll see you in the next video. Bye for now.